Okay, so this is a specific teething and nasal congestion routine. So for babies who are teething, if there's a build-up of mucus in their sinus, their nose, and they're finding it difficult to bring up, this is a very useful routine. So start off, make sure your hands are nice and warm. And we're going to bring our hands slowly and gently to the side of baby's face, okay? And begin with hold. Just hold, tune in, and see how baby is reacting. Okay, we're going to begin with thumb paddles. So both thumbs, centre of the forehead, and we're going to paddle outwards. So from centre outwards. Do that several times. Always be mindful as well to not lean in over baby. If you need to prop them up, if they're more comfortable propped up, do that. If they're more comfortable lying flat, you can do that. So paddling from the centre of the forehead out. Then be mindful not to bring thumbs over baby's eyes, but come in under the eyes, and we're going to paddle from the centre of the nose down under the eyes. So the bridge of the nose down under the eyes. Paddling from the centre out, nice and slowly, and use a little bit of pressure here as first we start off in a stroking, so a little bit of pressure then as we come in under the eyes. These are little sinus points, and just see how baby's reacting. So a bit of pressure, but obviously make sure it's comfortable, that they're not showing any signs of discomfort. So you can press along the sinus on the top of the cheek and out. Okay, then we're going to use cheek circles. So when we use cheek circles, with our thumbs, we're moving those cheeks. So we're literally really moving the cheeks. So it's not just massaging over the cheeks, we're really moving them. We want to get lots of circulation into that area. So the more blood circulation that comes into that area, the quicker the teeth are actually going to come through the gums. So it really does make a difference for babies that are teething. It can shorten the length of time those teeth are breaking through. The more circulation that comes into that area. So big cheek circles using your thumbs. Checking baby is comfortable all the time. Going to work along the jawline again, using our thumbs, little circles. This time we're working over the skin, along the jawline, from the centre of the chin to right under the ears. Okay, and rest hands. Okay, and that's the face routine for teething and nasal congestion. Then we're going to move on to the hands and the feet. So in hand reflexology, the front and back of the fingers relate to all of this area here. So basically all of the head, face, sinus, cranial nerves. So by working these fingers and the toes, we're going to give extra stimulation. So there's extra stimulation to this area. So we're going to start with thumbs, and we're going to massage up and down. So gliding up and down each of the fingers, supporting at the wrist. So we can do this minimum 6 times, but as much as you like, and as much as baby will allow as well. So always checking in the baby's happy. If babies are scrunching in their fists, you can try massaging the outside of the fist, so that they'll open up the hands for you. You continue gliding. Up and down, and continue all the way along each of the toes. Good pressure. You can use a little bit of cream or oil, maybe organic sunflower oil if you like for this. You don't have to use anything, but if it feels dry, then you can use a little bit of oil. If it's something like organic sunflower oil, it's absolutely fine if babies put their hands in their mouth afterwards, because it's not dangerous for them. Okay, working all the way along the hand, all of the fingers. Repeat on the second hand, and then we go to the feet. And we're going to begin with big toe and do exactly as we did on the fingers. We're going to glide up and down each of the toes 6 times, so supporting the foot. We're going to glide up and down nice and slow, and make sure we're covering all of that area, that we're not just on the toe pads, we're really getting down the neck of the toe, up and down. Minimum 6 times. You can do it as much as you like. Again, if toes are curled in, which babies often will, if they've never had a foot massage before, they can be a little bit suspicious in curling the toes. So just give them time. Once it registers with them that it's an enjoyable experience, you will find the toes will open up again. Don't force it. If they're not in the mood, try again later. So we're getting as much heat as we can into those toes and into the fingers, and by doing that, that stimulates the nerves, those hand reflexology and foot reflexology nerve endings, and stimulates all of this area as well. So we're not just doing the face, we're doing hands and we're doing feet, and that's a really good routine for teething and nasal congestion.